Thank you so much. Can I just a confirmation that you can hear me? Great. Thank you, and thank you so much, CPSA, for this great privilege to be able to present and talk a bit about the work of Zipline in delivering medical products using drones. It's a topic that I'm very passionate about. And just to correct one thing is I'm currently on the advisory board of the International Pharmaceutical Students Federation, but on the strategic plan committee of the International Pharmaceutical Federation. So there is always a confusion between the professionals and the students. Going quickly into the presentation about Zipline. In Rwanda, maybe first of all, I should say what is Zipline? Zipline is an American company that manufactures drone to be able to deliver medical products, and they manufacture the drone and they operate them themselves. And then why did they choose to start working in Rwanda is because Rwanda has an ambition and being it's the only sub-Saharan African country which achieved all MDGs, health-related MDGs, Millennium Development Goals. And then towards the SDGs, Rwanda has a goal of ensuring access to patients where each Rwandan can access care between 15 and 45 minutes. And they want to empower providers where there is 0% stock out and completely eliminate waste. That is very ambitious for a country, a developing country, not a very developed or super rich country, because this has far-reaching implication. And so the mission of the country, Rwanda, kind of intertwined with the mission of Zipline. And so Zipline created a very simple service, on-demand drone delivery service. So it's simple. The first step is a health facility placing an order via mobile for medical products, any products. Then at Zipline, we prepare the package and dispatches the zip. And then our plane, we call them zips. So it's a drone or a zip if you want. The zip flies to the health facility in 15 to 45 minutes. And when it arrives to the health facility, it drops off a package in a parachute box. And we notify the recipient that they've received their order. Before going further, I would like us to be able to watch it in action.
How can a mother please? How can a mother please? She's dying. She's dying.
I hope you find that fascinating, as I always get it whenever we are doing that on our operations every day here. So let's look at the technicalities of how the zip works. Usually these drones weigh 12 kilograms and they have a wingspan of about 2 meters. We don't have a pilot, so pretty much everything is automatic using GPS signals and telephone signals, basically with SIM cards and SD cards being able to use cell towers or cellular network. They're fully electric and they can fly as far as 150 kilometers on a single battery charge. Each of Zip has a cruising speed of 100 kilometers per hour and it can fly as fast as 130 kilometers per hour. It flies above the ground on 100 meters. So we use, how do we call it? We use a technique called hugging the terrain. So it has to stay 100 meters above the ground. And then when it reaches the hospitals, it makes helixes to descend to between 10 to 15 meters. And then it drops the packages at the hospital in that case. And we have different flight protocols that we follow with the Rwanda Civil Aviation Authority, and we are fully integrated in the Rwandan airspace. This is the technical part of it. In 2017, we made 3,000 deliveries. That means we delivered more than 6,000 blood units. And we deliver 4 types of blood units. Usually here in Rwanda, we deliver red blood cells, fresh frozen plasma, and platelets. And so any type of blood units that we deliver, usually the hospitals can only store at the hospital red blood cells, but all other types of blood they can't store at the hospital. We have to deliver them in emergency. Because the hospitals in Rwanda or in most rural areas are not equipped to store these blood products. And another thing with blood is that usually blood is high in demand but low in supply. So it's good when blood is centralized and then whoever needs it gets it on demand. Because in Rwanda we have a challenge that most developing countries get to have is usually the medical products are not available when they need them, or the blood is not available when you need them, or the donor of the blood is, for example, on the other side of the country while the receiver is on the other side of the country. So it's important that we receive the blood very quickly when the patient needs to receive it. So what we do at Zipline, we are restocked 3 times a week by the National Center for Blood Transfusion, and we hold enough inventory and we can deliver quickly to each medical facility that transfuses. So we have saved the government of Rwanda more than 13 million Rwandan francs, which is about 13,000 US dollars. And we usually take 12 minutes. So when a hospital places an order, it takes us at least 12 minutes to be able to package the order and send it out with a drone. And we've saved all the hospitals 10,000 hours of driving that they would have spent just driving instead of doing more important work at the hospital. Yeah. And these are some testimonies that we have of patients who have been saved using the drones that we do. This is a patient who would have otherwise either been transferred, lost their life, or anything bad could have happened to this patient. However, the Kabgayi District Hospital made a demand to Zipline, and we delivered blood in time. We sent about, I think, 5 packages to be able to deliver this patient and be able to get her cured as soon as possible. And not only we are helping patients get access to care, we are also helping the government and medical facilities save money. We are eliminating stockouts completely. Like for blood, there is no stockouts that has been reported since we started working. And these are some testimonies from patients and lab technicians that we've been working with who had an issue before of having blood stockout. For example, one blood bag costs up to $100 to just manufacture and keep, and now without including the cost of keeping it and transportation and so on and so forth. So by eliminating stockouts, it's a lot of money that we save the hospital, and we increase access as much as we can. We also empower pharmacists and health providers, because one of the things that, as you may know, a pharmacist or a health providers will not stay in their job if you are not able to provide the optimum care possible. And that's an issue in many African countries or developing countries where patients or, usually health professionals don't want to work in rural areas because they are not providing the optimum care. They don't get satisfaction from working in rural areas. So when we provide access to rare blood products or rare medical products or emergency medical products, and then these health professionals know that they can access care, know that they can access all medical products that they need and provide optimum care to their patients, they are able to stay in their job and do everything that they can do for helping their patients. So we've eliminated stockouts and helped, everyone in the health system to practice at their highest level of training. And we've empowered also health workers to do other benefits, like the system of healthcare is very strong at the lower level, and we've reduced also the need for patients to be transferred from hospital to hospital. So the community also trusts in the hospitals in their community. And there is not this myth where if you are in a rural village, you can't trust your hospital. You only have to trust the hospitals in the city. With access to medical products fast enough, people now trust their facility and their doctors more. And so this is, we are currently serving the western side of Rwanda, and we hope to be able to serve the eastern side of Rwanda as well. So this is a map with all the facilities that we are hoping to be able to serve in the near future. We will have 2 distribution centers, one towards the center of the country and another one in the eastern part of the country. And this distribution center will be able to help us serve as many hospitals as possible. And so Zipline has a new generation of drones. This is something you probably have seen in the news. This is a much more advanced, which will scale our operation greatly, and it will help us grow very fast on how we do and increase the number of deliveries that we can do. I will not go into details. However, it increases the range significantly, it increases the speed, and increases how much kilograms we can transport. For now, we transport up to 1.5 kilograms, and the new generation will go up to 2 kilograms. And you can read more about it. And maybe before I get to take your questions, one thing I can add about this thing is, why is it so important for me as a pharmacist to work here? One thing I've realized is we are sort of redefining how to get supply chain to be done. How do we do supply chain? Because no one else has ever done this in the world, and I'm kind of part of a team that is doing it for the first time, we are here to try and think the impossible and the unimaginable that has ever done before. And we sort of come up with new solutions and new ways of designing supply chains that are effective and that work, effectively enough to respond to questions. So yeah, I have about a good number of minutes. So I wanted to go through the presentation really quickly to give you a general picture overview. And then it's better when I talk through your questions more. And depending on your questions, I can detail more on what we do and on which aspect. So feel free to get to ask your questions.
Hi, Israel. I would like to thank you for your lecture. And while we are waiting for the questions from our participants, I would like to ask you something that I've always wondered about this, was how do the pharmacists react on drones? Do they think they're maybe endangered by their work so that they will lose their jobs in their community pharmacies, or are they really optimistic towards this concept?
Well, so at this point, since we are operating mostly with hospitals, but we haven't started looking at, let's say, making personal deliveries. But in the US, like here in Rwanda, it's with hospital, but in the US, Zipline is greatly thinking about how can we do personal deliveries. yeah, it's quite a challenge. And recently I was in a conference where we were talking about this, and you could see that pharmacists are really afraid that this can drive their jobs out if Zipline starts making personal deliveries and sort of replacing the community pharmacy. Because it's as simple as this. You can do anything that you want online at this level, where you can get your consultation. At least here in Rwanda, you can do consultation online, you can get your prescription online, and let's say you can place your orders online if that's possible. And then Zipline works in the distribution service, partnering with, let's say, an online pharmacy, and they can deliver everything to you quickly. So that's really a challenge, and that can drive out the job of a community pharmacist. However, I usually advise pharmacists to, and student pharmacists to also look at the fact that how can we not only think that this is a disruptor, but how do we use this to probably enhance how we provide care, and how we provide care in terms of what is it saving us in what we spend so much time on. And so how can we capitalize on every other thing that the pharmacist can be very beneficial on in a community setting, and be able to provide access on that. So not really answering your question. Yes, it's a challenge for pharmacists. They think it's a challenge, but I also think it's more of an opportunity for us as pharmacists to focus on the essential of our profession, other than spending so much time in filling prescription, in filling in reimbursement on insurance, and so on and so forth.
Thank you for your answer. I think I get the picture. We have another question from Tayana. She wonders if there is a potential of implementing this project on a larger scale in other countries, and if yes,
yes. So currently, Zipline is more interested in sub-Saharan Africa and Eastern Asia, so Southeastern Asia, yeah, where there is really a challenge on access to medical products and access to, the supply chain is really having difficulties in delivering medical products to their patients as they need. And so the first country was Rwanda, the second country is likely to be Tanzania, and we are currently in talks with multiple countries within here in Africa and soon in Asia. However, we will also be working in the US before the end of this year, because the US is slowly opening up on their strict regulations that prohibited drones to fly. So Zipline and different states like Texas and Arizona are currently partnering in identifying the possible solution of using drones to deliver essential and emergency and blood to health facilities in rural areas of those states. So it's a project that will certainly grow and grow bigger. Maybe one of the things that will be challenging at this point is how will Zipline maintain the capacity of manufacturing drones and running operations at the same time? That's for me a fascinating thing that I look forward to be part of and be able to understand how we can do that.
Yes, Diana, so if you have any
I hope that
questions,
answers your
just
question.
write them in the chat. I would like to encourage everybody else who has any questions to ask them in the chat. Don't worry, Israel is great at answering them, as we can see it. I have a tough question coming from my co-organizer, Zvonimir. He's wondering, were there any negative reactions to the drones in the beginning, and now do you see any negative reactions in the people you work with, the hospitals, or anywhere else?
Oh yeah, so yes, we see that a lot, and that's why at Zipline we try to focus so much on community outreach and community education about the potential and what the drones do. So some people will think that these are spies. They have cameras probably. For the neighbors, people who stay around our distribution center think they make so much noise because we work from 7 a.m. to 7 p.m. and sometimes we can work up to 9 p.m. And so people really have perceptions. However, when we do our community education, we try to show the positive aspects of it. And we use mostly the patients as our ambassadors in the community, where they kind of try to explain to them, hey, this has helped me, because usually the patient would have get transferred. If the patient is transferred to another hospital, then they are transferred with their children. That means it's two people who are not working, not going to school. And so we try to showcase the whole positive aspects that are around it, which is very significant for the population, because the population will never understand that you are saving the government money or the hospital money. They need to understand what is the benefit of this thing at my level of understanding. And we do a lot of that. And then when they get to understand that, they now, really become our stakeholders and help us, educate other people in their communities. And they really welcome this initiative in so many ways. And we also we open up our distribution center so anyone can visit us, anyone can come and look at how we launch the drone, how everything, so that they are less fearful about them.
Okay, thank you for your answer. I hope Zvonimir is pleased with it. Tajana says she got her answer. And we have another question from Leo. He's wondering, were there any accidents like drone crashes throughout?
Yes, so we don't call them accidents or crashes. We call them parachute landing. So one of the best things about the technology is each drone is built with a parachute so that it can, whenever, you never know, there are a lot of human and non-human conditions and errors that can go on. So when something is not normal, it will just recognize that it's not in a nominal situation, and it will open up its parachute and then land gently via parachute. And so, but what Zipline has tried to do is we have tried to limit those parachute landing to first less than 1% of all the flights. So if we have 3,000 deliveries, then we need much less than 30 parachute landings, or much less than 20. And the second thing we also try to do is also make sure that technology allow us to make the delivery, and most of the parachute landing only happen on the way back. So when the drone goes to the hospital, make the delivery, when it's coming back, that's when we can have parachute landings. And so we have had them, but they are very much few and less than 1%.
Great. I hope that answers Leo's question. I think that's a really great percentage. So there is another question from Miranda. She's wondering if there is a potential in using drone delivery in emergency or refugee crisis, and can it be associated?
Yes, I will add more on that, not only on refugee crisis or humanitarian aid, but also in epidemic crisis, let's say the recent Ebola or any other epidemic crisis. So how Zipline look at it is twofold. First of all, is our distribution center is something that can be easily set up in less than 2 weeks, right? So everything that allow the distribution center to operate and work, let's say the launchers, the recovery system, where we store our medical products, all that. We are trying to develop a solution and building it in a way that it can be built in less than 2 weeks. And when it's done like that, we can easily set up a distribution center on an empty field anywhere. And in less than 2 weeks, we are able to respond on any humanitarian or health crisis of any way. And those are the things that we're also looking to think about, not only building permanent structures in countries to supplement the supply chain in those countries, but also for countries which have like really good supply chain, but may have issues in humanitarian and any epidemiological crisis, we can set up a distribution center in less than 2 weeks. and be able to start delivering medical products and anything else that can be delivered, not only products, but in a humanitarian crisis, you would think of a lot of things that people would need to access as fast as possible. And so, yeah, that's a thing that we are doing. However, we haven't started sort of testing of how it could work, but we are looking forward. It's one of the things. For example, here in Rwanda, our second distribution center that we are building, and the distribution center that we'll be building in Tanzania, we are trying to implement this way of dropping it and coming up with it in less than 2 weeks, which can help us really scale and be able to respond to any type of crisis.
Thank you. That sounds really great. So now a more general question coming from my colleague Eva. She's wondering what your workday looks like. So do you have any office?
Yeah. Okay, yeah. So we have 3 teams here. We have an operations team, like flight operations. So these are the people who usually take the package, put it in the drone, and launch the drone, right? As you could have seen in the video. Then we have the fulfillment team, which is the team that usually is in the fulfillment center. They package all medical products. They receive orders and they conduct customer service on a day-to-day basis. Like they are in touch with the hospitals. Then we have us, the team I work on. It's called the national implementation, or a more Silicon Valley term is called customer success. So what we do in my team immediately is dealing with the government and making sure the services that Zipline provide is more integrated into the health system. We also talk with the Civil Aviation Authority, so we make sure like Zipline is respecting all the civil aviation rules, and we also make sure we are well integrated into the national technology and industrial revolution ecosystem. That's what we've been doing at this point, and that's our day-to-day work. However, it's the type of company where we don't really have offices. We have more of desks and just an operation area. If you want to work, like some of us need to do deep dive work, we have like our houses where we stay and we can do our work from here. However, here at our distribution center, it's an active operation center, and you can contribute to anything. If, let's say, there are many orders coming in at the same time and people need more hands, you can also be able to contribute to that. So what I like about it is I'm an unconventional pharmacist. Like, I don't think I fit well in just sitting in a pharmacy or at hospital. I like doing different things which are so different from what I usually do. So that's why I kind of also, go into looking. I also work on aviation regulation. I can go in looking how they are doing drone operations, like launching it, recovering it, even if I'm not the person in charge, but I can support, I can help the people. So it's really good, and it's a great place to be.
Yes, that sounds really unconventional. So we have another question from Muhammad. He's wondering, is it safe to carry thermolabel and light-sensitive medicines with the help of drone? As temperature in Asian and Middle Eastern countries reaches 50 degrees in summer, so if yes, what precautionary measures could
Yeah, that's a really good question. And this comes with how the technology is evolving. So the temperatures in Asia and Middle Eastern pretty much reach the same temperatures that in the US, where we test our drones before they come to fly here in Rwanda, in California. It's equally hot sometimes. And so what we've done is, first of all, the compartment where we put our package is made to be insulating temperature, so the temperature doesn't change so much. That's the first thing. And the second thing, when we also package, we sometimes add ice packs or just cold water, depending on what is the product that we are delivering. However, as this evolves, and for your information, we've done a research with Emory University to sort of understand in what temperature ranges, what speeds, what any type of issue that could affect blood quality at this point. And before we fly blood, it was so important to prove to the government of Rwanda that whatever we are flying is safe, because we needed to do this research and it had to be validated by a researchers in safekeeping it. And then, yeah, for other products, we are thinking about as the technology evolves, as the drone changes and gets better, we are thinking about how to improve the compartment where the packages are stocked to be able to respond to different needs and demands of each product that we will be delivering, because it wouldn't make sense if we can only deliver certain amount of products and not really the most like the thermolabile and light sensitive medicines like the one. However, we do use carbon fiber and so on and so forth, which, for example, prevent any contact with light during flight and pre-flight. Our boxes are designed to also prevent any contact with light. And then they also prevent any changes of temperature that would be damaging to the product. That's how it's built. And we've done a lot of tests to be able to get it validated with Emory University and their hospital.
Great. That sounds really thoroughly investigated. And Mohammed, thanks you for your answer. I've also wondered.
Yeah, that's another great one. So the drones in the world have had a bad reputation because different powerful countries have used them for war, and they were never really used for any good thing, right? And so Rwanda is positioning itself in its development agenda as the technology hub in Africa, and especially in East Africa, where Rwanda wants to be the place, how can I say it, the Silicon Valley of Africa, the Singapore of Asia, or South Korea of Asia, if you want. And so in doing that, Rwanda is sort of ready to take risks, like bringing this technology that has never worked anywhere, start a national-wide drone delivery system that has never been tested anywhere. There was no drone regulation. Like, drone regulation, official drone regulations were published last month in March, in the beginning of March in Rwanda. So it was based on a mutual trust. First of all, Rwanda really trusted Zipline, and then Rwanda took the risk of testing this thing, and so that Rwanda can be able to be the leader in the industry. So in that case, Rwanda is now working with the World Economic Forum to sort of help other countries develop the appropriate regulation and be a place where these countries can come and learn. And it also benefits Rwanda in other ways. For example, there is a diversification of jobs. This also improves the economic ecosystem, the technology ecosystem. For example, different light manufacturing companies of these drones would be interested in setting up their industries in Rwanda. Zipline, as Zipline scales across Africa and East Africa, they will want to start manufacturing most of the things here. And so there are a lot of things that Rwanda could get from here, and especially the fact that Rwanda wanted to position itself as a leader in technology and especially in drones for humanitarian services and health services was why Zipline and Rwanda kind of were the perfect match, if I can say, because Zipline had been talking to different countries for a number of years in trying to understand who would be the best partner, and it ended up being Rwanda.
So that's great, and I can see the program is working well there, so there's a lot of opportunity to go further. And here we have another question from Saurabh. Other than delivering life-saving drugs, what are your views on providing services of diagnostic tests to the lab's deprived area by collecting blood samples?
Yes, that's a good question, and I will try to answer it by explaining to you the drone technology. So Zipline there are different types of drones. We have fixed wing drones, like there are fixed wings, it's like an airplane. Then we have quadcopter drones, which like helicopters. So one of the issues where we would like to be able to collect blood samples from one area and transport them to a laboratory area. However, that needs a technology that is very complex and much difficult to be able to do. Because the current drones that Zipline use do not land, they just fly 10 meters above the hospital and then deliver through a parachute, but they don't land at the hospital. Then they come back and land here where we work from. So if we want to be able to land and take off at the hospital level, the challenge becomes you have to put the infrastructure at the hospital level, you have to train people at the hospital level, and those drones are usually quadcopters, like small drones that are like helicopters. They can fly as far as 5 to 10 kilometers, so that's not far enough to be able to ensure the access that you want. And a lot of players in the industry of drone manufacturing are looking into how they can respond to that. Before coming to work for Zipline, I was working for another company which was helping organization and linking them with other drone companies to be able to find solution for that. And our first program was in Malawi, where we were working with UNICEF and Matternet, a drone company called Matternet, in using drones to transport blood samples from the villages to a central laboratory. UNICEF was using helicopters before, and we were helping them where I was working before with Matternet to kind of decrease the cost on helicopters that they were renting every other week to now use drones which are much cheaper. But the issue was the drone can only fly low distances and it can only fly in line of sight. So it can only fly where you can see and it cannot go far. So we would like to be able to do that, but the technology at this level hasn't evolved to respond to that that much. That would be something that is done in small cities or across 2 mountains or something like that. But it's something that Zipline is not really looking into the possibility of landing and picking because that costs a lot. But the industry is really thinking about that in so many different ways to be able to address those challenges.
Great, so there is a lot of place for challenges and improvements here. There is another question from my colleague Thea, and she's wondering, as far as we can see, so the drones were established because of a lack of infrastructure, but also for speed reasons. So is there any option that building a different type of infrastructure is better than using drones? Are drones better because of their speed? Because
Yes, that's a good question. So, for example, what I think Zipline is doing, we don't want to replace the existing supply chain. We don't want to block building infrastructure. For example, on medical products, we will not deliver all medical products. We will not be the primary people to deliver medical products, right? The supply chain will remain as it is. Rwanda has one of the best supply chains in sub-Saharan Africa. However, what Zipline does is a system strengthening. So, for example, if like how it works in Rwanda is there is a push system, like there is a central level of the supply chain. They push medical products to a district level, and then those district push medical products to the facility level. However, because of different challenges, there might be a problem with planning, where the hospitals cannot really predict accurately what type of products they can use, right? And so they now have to come back to take emergency products while in operation, and that involves a lot of cost, a lot of time wasting, and because they don't have like appropriate planning, they also oversupply themselves, then a lot expire at the hospital. So it creates a mayhem of challenges and things that just doesn't work, and the system kind of gets an issue. While the supply chain was fine, the infrastructure was there, but when it comes at the hospital level, there is always an issue of planning, right? And so what Zipline wants to do is to be that part of the supply chain that doesn't require you to think so much about how to plan or to think in terms of lead time, for example. Let's say if you want to order medical products, you will think about how much time will it take me. So I need to order enough to be able to cover the lead time. I need to order enough, and so on and so forth. And when it's small health facilities, like the ones in Sub-Saharan Africa, you order a lot of products, which is a lot of capital that is on shelves. So for example, you have 3 months of stock of a product, but you don't renew beds because medical products are much better to have than buying a new bed for your patient. So it's a whole health system issue that you need to understand, and especially in these countries where we serve, where there are a lot of challenges that are not only infrastructure, but it goes into the health system, into supply chain, into access, where you need to understand building infrastructure is definitely the best option. But what Zipline is offering is providing that health system strengthening aspects of the health system, not really being the best infrastructure or replacing the existing infrastructure. It is more of, strengthening the system.
Okay, so I can see now a clear picture of it, and I hope Tea does too. We have another question from Farhaj. He's wondering, he says that it is very expensive to buy drones in Pakistan, and how can
That's a good question. So this is a good, the thing that Zipline thought about is, in this thing, the government doesn't buy drones. That's the first thing. And the government doesn't operate the drone at all. So Zipline build, manufacture the drones by themselves, and then what we do, we also operate them ourselves. So what the government will pay is only delivering, right? So the government will only pay for delivery fee. It's like there is a bus, there is a car, you didn't buy the bus, you didn't buy the fuel, you just paid money for you to move from place A to place B. That's the option we give to government. And so maybe to just provide further details on how Zipline gets financing, Zipline is thinking about a new way of financing healthcare, and it's a new way how it's working in the world in general, where we are looking at co-financing in healthcare, the public-private partnerships. So if the government can only pay for delivery and transportation, there are other actors like philanthropies, the Gates Foundation, Gavi, and so on, who are more interested in developing this technology. So those will be able to fund now the development of the technology, like manufacturing drones and so on and so forth. So it's a way of generating funds from different sources, but getting the government to pay less. And it's new. I think these are new ways of financing healthcare that people are rethinking. For example, in many countries, if you see that the developed countries no longer give directly to government money. However, they can give to private companies a certain amount of money to implement a program, and the government that has to benefit from it will just pay for little, and they don't have to deal with the burden of managing the whole thing. So that's the way Zipline kind of operates. So the government doesn't have to buy the drones. They don't have to operate the drone. The government will only pay for delivery, for delivering the products from point A to point B, and Zipline will be in charge of generating and collecting funds from elsewhere. However, if the volumes of what Zipline delivers is a lot, Zipline can now make profits. So if we deliver 300 deliveries in a day, that can make profit than if we are delivering only 20 or 30 today. So that's the way we are looking at it, and that's how we are thinking at it. It's a combination of the new ways of financing in healthcare, in providing aids to developing countries, and what the philanthropists and other development agencies look to when they are trying to improve lives of people and financing healthcare in general.
I hope Fasha got his answer. Oh yeah, he says thank you.
Yeah.
Well, there is one additional question. How did you decide to study?
That's a good question. So I don't know about you guys, but in Rwanda at least, you study pharmacy because either you didn't get into medicine, and you didn't want agriculture, or whatever is after pharmacy. So for me, I think I wanted to work in healthcare, but I wasn't really passionate about being a medical doctor. And that's how I felt like pharmacy was the best place to be, because from early on, I had discovered that pharmacy kind of gives you the option of branching out in many different areas of the healthcare system, while, medicine kind of blocks you in certain way, and you are not flexible enough to move and be flexible on doing different things. And then as I went through my education and I started discovering things, I started discovering new ways of doing things. I came across, people who are using different technologies to respond to healthcare needs. And when I discuss with people, you start realizing that there is a lot of solutions that are coming up which do not really involve healthcare professionals. So there are artificial intelligence solutions, there are wearable like watches solutions, there are application solutions that are coming up but do not really involve healthcare professionals. So I started thinking about, what are the new ways that healthcare can be provided? And I really like being in a position where I'm so much challenged to do new things, because I hate routine. I hate waking up and spending my day repeating the same thing and do that for my whole lifetime. So this is how after graduation, I said, let me just take 1 year off and travel the world. Luckily, I got elected as IPSF president. And so while taking into my responsibilities as president, I also used it as an opportunity to discover the world, to discover how different things work. I got fellowships in the US and other parts of the world where I could experience hands-on like what's new that people are doing to respond to the needs in healthcare, instead of, just doing routine. And so I also met this previous company where I was working before as a consultant for helping NGOs and drone manufacturers to connect and be able to respond to humanitarian challenges. And that's how I got connected to Zipline. And yeah, here I am. It's a great challenging experience on trying to solve problems in healthcare, but completely new ways of going about it.
Thank you. We have another question. I believe that will be the last one in this Q&A. Yeah. So Saurav wants to know how a pharmacist can find her place in the industry, and this.
Yes, I think that's a really good question. And I recently spoke at a conference for pharmacy students here in Rwanda, where my presentation was simple, just showing them the innovation that are changing how we provide care as pharmacists. And it's a lot that is going on. At this level as pharmacists, we may not know how to go about it, but I think the first step is being informed, like knowing what's going on, like how does this thing work? Who is behind it? How are they answering this question, and this question? And then the second thing is think about the value of a pharmacist. You remember one of the first questions was, how are pharmacists perceiving this which is coming in to replace their job? Now, I would challenge ourselves as pharmacists, and young pharmacists especially, to think about this thing is probably solving a problem, an administrative problem that I had. But what else is my role as a pharmacist, or my added value as a pharmacist? And you look at that value and you make sure that That's what you bring to the table. Because this technology company will never come and say, we want to hire a pharmacy. No, these people are smart enough. They will learn them by themselves and start doing it. That's how Zipline is. It's run by people who worked for Boeing, people who worked for NASA, and they started asking themselves questions and they started answering them by themselves. And that's how they're disrupting the whole supply chain. But then when you think for yourself, you look, this is an added value that as a pharmacist, I can bring to the technology world, and you make sure you capture that value. How can I say it? You capture this value with, you make sure this value is clear and you are able to sell it. It definitely positions you in the industry as someone who knows what to do in relation to that. So basically, creating value is knowing or identifying what, as a pharmacist, you can add to the technology. Because when we think about the fact that the technology will disrupt, we will never be able to solve them or to be integrated or to work in it. But if we think at it as, hey, this is a technology, but as a pharmacist, I have to find a way to involve myself, then you will think about your value and what is new that you can add to the table as a pharmacist, and that's how you will be part of it. I cannot give you specific example, like the pharmacist will help in this, will help in this, will help in this, because our knowledge and education is very broad from country to country, but I am so sure that there is something we can add to any type of technology in healthcare, in supply chain, and in anything in health. Yeah. I hope that answers your question or give you a small hint on how to go about it.
Thank you, Israel. I hope we haven't bothered you too much with our questions. There were a lot of them. We are so happy you could participate, and I hope this wasn't too stressful for you.
I very much enjoyed this, and I think it was so good to have enough time for questions, because it helps me to speak more than I can put in a presentation. So it's no issue, and I'm really happy. And thank you again for inviting me and having me here today.
Thank you once again, and we will be now moving on.